Transforming healthcare to deliver effective and affordable services is one of the agenda of Governor Darius Ishaku. On the program this week, our focus is on healthcare delivery. My name is Nelson Etta. Join me as we discover Taraba. Innocent Vakai is the Commissioner for Health in Taraba State. He speaks with Discover Taraba on efforts by Governor Darius Ishaku to deliver effective health care to people of the state. Commissioner, thank you so much for having us in your office today.
Nelson, you're welcome.
Yes, sir. I know His Excellency has a passion and a vision for the well-being of Tarabans. It's almost 8 years now since he's been the governor. Could you highlight some of the things that he's done in the area of health?
When His Excellency came on board on the 29th of May 2015, he inherited a health system that was comatose. Most of our hospitals were dilapidated. The human resources for health was nothing to talk about. We don't have enough nurses. Neither do we have enough doctors, laboratory scientists, and pharmacists. So in that vein, when I was appointed the Commissioner of Health, we sat down with His Excellency and strategized how we are going to move the health sector forward. In doing that, first we identified that we have to bridge the gap of the human resources for health, starting with the nurses who are in acute shortage. We realized that a lot of them have retired, and new ones are not being employed, and the College of Nursing has been closed down for 10 years as of 2015 because of loss of accreditation. So he mandated me to recall the retired one, which we did, and then we employed over 150 new nurses and injected them into the system in order to rejuvenate. You know, the health system operates just like the tier of government, where we have the primary, secondary, and tertiary. So the primary healthcare system, before the coming of His Excellency, we didn't have a primary healthcare development agency. When he came, he established it, he operationalized it. And we have renovated over 160 primary healthcare centers in each of the wards of Taraba State. Okay? Because the standard is that for every 5 kilometers distance, you should have a primary health care center to service the people.
Let's talk a little bit about the tertiary health institution. You said 3 of them has been developed in
secondary.
Secondly.
Yes.
Okay. Let's take Takum, for instance. The solar energy installation there is yet to be completed. Like you said, the equipment is already on ground, but yet it's not done. His Excellency has just a few months before he leaves office. Would that be done before you leave?
Absolutely. We'll complete all our projects before the end of the tenure. That of Takum has a structural defects because of the topography of the nature of where the solar panels were put.
Okay.
Originally, the solar panels were for 3 hospitals. That is Gembu, Wukari, and Gembu. I believe you saw that of Wukari.
Yes.
And you saw that of Gembu.
Gembu, yes.
That of Gembu was still on it, and that of Takum, they just collected the structural defect at the basement level. Okay, so when that is perfectly done, then they'll mount the solar panels.
His Excellency's exploit in the area of health is indeed commendable, because from what you said, that hospital was last renovated in 1960. And so is a lot of other hospitals that had taken a long time before any form of renovation had taken place in them. And so what His Excellency has done is pretty good.
Well, frankly, Nelson, I would say that we are lucky to have His Excellency as the governor in the last 7.5 years now, Architect Darius Ishaku. I have been using the word that he's a workaholic governor because he works round the clock to ensure that the state is working and the people are happy. I have been his commissioner right from inception, and we have worked closely together, and I can see the passion in him to improve not just the health sector and all other sectors in the state. That is a passion that has driven him to renovate most of these hospitals, to carry out innovations in areas that needed to be done. Mind you, in 2018, the Nigerian Medical Association gave him the award of the best, one of the best performing governors in the health sector. Okay? And that necessitated us to go to Rwanda to also understudy their health system. He was given that award along with the governor, the former governor of Yobe State. Okay? And not just the infrastructure, he has, when he came on board, there are other infectious diseases that are on increase, but he tried to reduce it to the barest minimum. Like HIV, when he came, the prevalence in this state was 10.5%. Second to rivers, which was topping the chart. So the last survey done by the US government in collaboration with Nigerian government, University of Maryland, the NAIS survey, okay, we came with a prevalence of 2.8%. Going from 10.5% to 2.8, you can see that a lot of work has been done on that. Secondly, another infectious disease is hepatitis, which prevalence was very high. Hospital-based data shows that it was almost 11%. Then he went into partnership with Roche and Taraba State government, and we are still on that project, and the prevalence is going down. Okay? Poliomyelitis is one disease that Nigeria has, Pakistan and Afghanistan has been doing, the only country that have been left with the wild polio virus. But we have existed that 2 years ago. Taraba State has not recorded any, because His Excellency has paid all the counterpart funding to carry out supplemental immunizations on this poliomyelitis, and that's virtually we don't have it now. So he has done very well in those areas, and occasionally we have outbreaks of other infectious diseases like cholera. Okay, recently we are talking of monkeypox disease, okay, Lassa fever. He has done very well in trying to combat them from time to time by injecting funds to carry so that the needfully done. Okay, thank you.
Thank you so much.
Thank you, Nelson.
To achieve the desired goal of ensuring affordable and accessible health care for residents of Taraba State, Governor Darius Ishaku built solar power systems in 3 general hospitals in the state. They are the General Hospital Wukari, the General Hospital Takum, and the General Hospital Gembu. Apart from the newly built solar power systems, which ensure 24-hour electricity supply to the hospitals, the governor also renovated the entire structures. The administration also built luxury apartments for staffs of the General Hospital and also equipped the hospital with modern medical facilities.
When he came on board, there was only one specialty hospital of the state government. But I tell you, His Excellency decided to construct and renovate 3 important hospitals in each of the zones. In the south, you go to what we used to call Wukari General Hospital, which today we have consultants there. He transformed the whole place, renovated it, and brought in consultants to take care of the southern zone. So there will be no need traveling all the way from the south to Taraba, to Jalingo for treatment, since you have consultants in the Wukari. And in the central zone, you go to Sadona local government, where you came, you said you visited the Gembu Hospital. It is now a new brand hospital, renovated and constructed by His Excellency, which is yet to be commissioned. You go to Karilamido too. You can't go there now because the road is actually bad. But that hospital was constructed during the missionaries. And His Excellency transformed, constructed, renovated, and it is a new brand hospital. It will also be commissioned very soon by His Excellency. So, in health-wise, you can attest to the fact that His Excellency has done tremendously well. The specialty hospital here, we have consultants there, and they're doing very, very well.
At the General Hospital, Wukari, the secretary and other administrative staff took us on tour of the facility within the hospital.
I want to start by thanking the administration of His Excellency Governor Darius Dixon Ishaku for actually the complete renovation of this facility. Actually, prior to 2015, the facility was in a very sorry state, but when he came, he ordered for a complete renovation of the facility. Now, this is one of the facilities he installed in this hospital. This is a solar system powering the entire hospital. So yes, since this facility was installed, there is a very strong solar energy to the hospital, powering even the MRI room. And then, since it was installed, there has never been any interruption in power supply to the hospital.
At the Gembu General Hospital, the hospital operations manager was on hand to take us on tour of the facilities.
want to thank you for the renovating of the hospital. We now have enough equipment, we have lights, we have water. So we want to thank you for everything that you have done. But at least, what I just want to say is that I just want to plead on you to at least increase our salary, because now we don't have enough this thing. The money have no value now. So our salary is not enough for us. So we are still pleading that I beg you should please and help us and increase the salary.
Everybody, either in Takum, Wukari, anywhere you go, Zing, this. Once somebody is sick, oh, take him to Jalingo. And when you get to Jalingo, there was no any hospital, only the specialist hospital. Specialist in name. There was nothing specialist with it, because all the equipments are dead, truly dead. So they were just coming here mostly just to die. So the health facilities were all moribund, bad. And then after resuming, I went to Gembu again, a thank you visit. I went to the hospital because I wanted to inspect to find out, is the hospital as bad as that of Sariti or Takum? While in the hospital, I was standing on a patient, greeting that patient as we were talking. Heavy rain came, and the whole roof was dropping with water. And my ADC was running, oh, God, let's go. I said, no, no, no. Allow me to be soaked. I will remember that this hospital must be among those to be renovated. And that is the story all over.
Wow.
So I decided what I should do is to pick some hospitals, key hospitals in the 3 senatorial zones. I picked Gembu in the central zone because they are very far and hard to reach. And also to remember the accident that happened during my flag off campaign, that something need to be done there. I picked the one in Wukari, which is the southern zone. And then I picked the one in Bamboo. Now Wukari was the first to be renovated. Since 62 or 3 that Sadona built that place, nobody has gone to even repaint that place. Then, if you want a hospital to function, you have to think of electricity. When you don't have power,
The machines can't work.
The machine can't work. The drugs will expire. The whatever, all. So it's an exercise in futility. So I designed the renovation of this hospital with solar power. They finished the renovation. All the equipment imported. We have an MIR machine, the latest imaging machine. If you go into MIR, takes the whole of your photo. It's not like olden days, they snap your photo, X-ray and all this. Everything comes out with MIR. Everything was designed there. I said, now, our next problem is the personnel. Do you know, I was shocked when I found out that we don't have nurses. No nurse. So how do we run this new hospital in Wukari? They said, no nurse. All the nurses have retired. All the experienced nurses are retired. I say, Commissioner, number 1 thing for you, recall all the nurses that have retired. Those that are still strong enough, they should be re-employed. And we'll employ them on contract 2 years. After 2 years, if they are still healthy, extend it for another 2 years. First thing we did. Then we said, look, we need doctors. We need consultants. We have to get a physician. We have to get a surgeon. We have to get a pediatrician. We have to get a gynecologist. At least we have to have 7 consultants for this hospital to meet the standard of the equipments we have brought. You can't spend billions to equip a hospital and then the manpower is not there. Since we're aiming at 7 consultants, I now said, look, I don't need anybody below 60, 65, or below 60, 65. I need consultants emeritus, those that have retired but are not tired. You know the reason? A person who has retired, who is above 60 or 65, is no longer worried about the things you and me will be worried about. Running here, running there, running there. Anybody at that age has already matured. His needs and wants are limited. I'm telling you, it will work as if I was a magician. Do you know all these consultants are always in the hospital? So when we started, patients aren't coming because they know it as a dead hospital. Now one wonderful miracle happened. They had an accident in the bus here, carrying people from Wukari. There are about 18 or 20 in the bus, critically injured. Immediately the CMO inquiry said, no, they should carry them straight to Wukari. Immediately they brought them. The surgeon was in the theater. The physician was following this. The man, everybody, the whole 17 or 18 of them got cured in Wukari General Hospital. That is when the story went around the whole town. And that is when people started to know. You mean in Wukari this can happen? They passed Jalingo, they passed the specialist hospital, and they came to this local hospital, and this is where they... So everybody now said, it is now. They knew that that hospital was just not as ordinary as it used to be. That brought up the hospital reputation. If the primary health centers are continuing, then the problems of the people at the hinterlands will come down. Then the bigger hospitals will not get too much pressure to bear. And if we're able to solve the security problem, I will be able to get professors emeritus to come and then service and help treat our patients where their mind will be at rest, where they will be sitting in the hospital waiting for patients, reading their newspaper.
Wow.
And where the children will come and see our toilets in the hospital and say, no, don't discharge me. I'm well now, but I want to stay here.
Oh, wow.
So that's a brief history about our health.
With the transformation of some of the major general hospitals here in Taraba, beginning from here in Jalingo, the General Hospital in Gembu, in Wukari, in Takum, Governor Darius Ishaku has ensured that Tarabans can now have access to affordable healthcare in Taraba. Until next week, when I bring you more on the exploits of Governor Darius Ishaku, I just want to say, keep discovering Taraba.